tonight we have a lovely, lovely, lovely guest. Sarah Talks is on to talk about sexuality. What is this show? This show is where we break mental illness, stigma, barriers. I want to restart all over. I'm totally messing this up. But anyway, so what we do here is we talk about mental health, okay? And we do that with professionals, other advocates. We talk about pretty much any subject. We have open discussions, open discussion days, and also we play games related to mental health. So thank you so much for being here. Everybody who's part of this community, everybody who's here is now part of this community, and I appreciate you so gosh darn much. Thank you so much. And Sarah, thank you so much for being here.
Absolutely. Thank you so much for having me. And hello to your community.
Yay! Hi, everybody. So to introduce Sarah briefly, Sarah is an American sexuality educator who prioritizes sexual empowerment, pleasure, and positivity. She's currently working towards a master's in education and human sexuality studies at Widener, where when she's not passionately talking about sex, Sarah can be found listening to music that makes her skin tingle. Oh, we like some ASMR. Spending time with her 3 fur babies and scouring the city for affordable vegan food. Listen, none of that's easy.
It is not.
Other than playing with your fur babies. That's a good time always.
Yes.
Yes.
It's a nice breakaway from the challenge of the other two.
Yes, exactly. So hi everyone, and welcome our lovely guest. Thank you so much for being here. Those are links. That's how you can find Sarah. Sarah is also a streamer on Twitch, so please go and make sure to give them some love. But Sarah, other than what I said about you, is there anything else that I missed that you want to make sure that people know about you before they start asking you questions? Because they're going to go after, once I'm done, they're going to go full speed. There's already questions in the queue.
Yeah, absolutely. So I am part of the LGBTQIA community, so I incorporate a lot of that into my work. And obviously, both personally and professionally, it's something that I'm very passionate about. And I also am very passionate about any sort of non-normative relationships, like things like non-monogamy and whatnot. So any sort of topic that really can be thought of as something that I try to, prioritize in my work.
Awesome. So I said, people were asking a lot about like the spectrum of sexuality in general. And I said we were going to focus more on like learning, like more of the physical aspects, but are you comfy cozy with us talking about like the sexuality spectrum and everything like that too? Like I kind of want to make sure that I know what your focus is.
Absolutely. Yeah. So I am entirely comfortable with whatever your audience is that they want to discuss. There's no sexuality topic that is off limits for me. I'm pretty much an open book. So.
Oh my God, easy peasy. Love it. So we kind of, to start, I guess, let's start light with the concept of like, where does sexuality and mental health intertwine? I want to talk about that. And specifically sexuality and mental health and libido. I thought that was an interesting topic. And then of course, LGBTQIA activism and how like being an ally helps people when they are trying to understand their sexuality and all that good stuff. So let's start from the beginning. How does mental health tie into sexuality?
So mental health and sexuality kind of play into each other in like a bi-directional manner where either one can affect the other one in different ways. So for example, if you have really positive sexual experiences and are comfortable and open about your sexual orientation or gender identity, that is going to have positive influences on your mental health. It can help diminish things like depression or anxiety. And obviously the reverse is true as well, where if you are having any sort of negative sexual experiences or are experiencing stigma or internalized shame about gender identity or sexual orientation, that will lead to more negative consequences that could potentially have harmful effects on one's mental health. And yet libido is definitely thrown in there as well, also in this sort of bi-directional manner where depression can affect libido in a way where it is, dropped due to feeling depressed. But what a lot of people don't know is that you can experience depression and still have a really high libido. So my first time going around with depression, I didn't want to admit that I was depressed. And part of the reason for that was, well, I can't be depressed. I still have a libido. So I just think that's something, that's worth noting.
That is worth noting, because I definitely feel that, because I think that was part of my logic as well when I first figured out that I was depressed. I was like, yeah, but that's fine. You know, that's been fine. And like, sometimes I'm happy, so I can't be depressed because sometimes I have feelings. You know, you come up with really weird ways to justify not having a mental illness.
For sure. You go down those like bullet points, those
Yeah.
checkpoints of
Yeah.
like what the symptoms are.
Yeah.
And if you don't have like one or two, you're like, oh, well then
Yeah,
I'm definitely fine.
I'm fine. I'm fine. Yeah. I don't know many people who are like willing and proud to admit, you know, not too proud to admit immediately that, you know, hey, something's up, something might not be 100% here. But yeah, so, and then, you know, you take medication and your libido goes up and down and all that good stuff, too. But so, man, sex and mental health just in general, like overall, I would immediately say like, after I have sex, I feel pretty heckin' great. But then there are also times where I will go into having sex, but I don't feel good, and then I can't focus, and so the whole experience is like blunted by that. Is that normal? I guess would be my first question.
Absolutely. I think that a lot of people sometimes will try and like force some sort of sexual activity out of themselves out of a desire for a sense of normalcy. If they're struggling, like, okay, well, if I can have sex with, you know, my partner, then things will feel better. But that force, that push usually doesn't work out for most people. You know, having sex only when you really, really want to is generally the best thing to do. And we do live in a society that like pushes compulsory sexuality in the sense where
Yes.
like, you know, like you should be having sex all the time.
All the time.
It's not entirely true for everybody always. And I think
Right.
that, you know, prioritizing only having sex when you really want to is good for all things, not just your mental health.
Right. Consent above all else. And I think that's come up in chat quite a few times. The other thing that's come up in chat is people, I want to know what the better approach is here. When people come to you and they tell you, oh, you're not asexual, you just haven't found the right person yet, or you're not gay, you just haven't found the right person of the opposite gender yet. Like, you know, whatever nonsense people say, like, who decides who I'm sexually or just attracted to in general?
Yeah, I mean, it's definitely a lot of that compulsoriness that kind of seeps into a lot of things. So we live in a very heteronormative, cisnormative society where it's kind of just, unless you have reason to believe otherwise, you expect people to be either straight or cis. So when you find out otherwise, you know, people are like, oh, well, you know, well, why? But no one ever questions why people are straight. No one ever says like, oh, are you sure you're straight? Like, have you tried having sex with somebody of the same gender? You know, that's not a question that people ask.
Right. No, that's 100% like on point. I also have another question. I have so many. Obviously, my job is to ask you questions because this is an interview, but like I have so many questions that are going to seem random and disjointed, but just bear with me, fam.
Lay them on me.
All right. So the G-spot, is it heckin' real or not?
It is real, but not in the way that most people think it is.
All right. Wait, dive into that. I want to hear more about that.
So originally, the person that discovered the G-spot claimed that there was an area on the the frontal wall of the vagina that has all these nerve endings, and when it's stimulated, you know, people experience extreme pleasure. So we now know that the vaginal canal actually doesn't really have that many nerve endings, because if it had as many nerve endings as, say, like the clitoris, imagine how much more painful childbirth would be.
Right.
So we're designed to not have too many nerve endings in there. But in that spot where people claim the G spot is actually what's called the clitoral urethral vulval complex.
Okay.
And there's basically a urethral sponge that sits on top of the vaginal canal. And then on top of that is the internal portion of the clitoris. Okay. So when you stimulate that part, you are actually stimulating the internal portion of the clitoris.
Well, that makes sense.
The urethral sponge. Yeah.
Well, that makes a ton of sense because the clitoris is like great. It does a ton of really good work. So then my question is, men people born as men also have G-spots? No?
Correct. So so the prostate is basically what is referred to as, you know, the G-spot for people with penises, which can be found inside of the anus. It's you know, about the same distance inside of the anus as it would be inside of the vagina for a person with a vagina. But yeah, it feels sort of like a walnutty texture. And so if anybody is looking for it, that's how you know. And stimulating that spot can potentially lead to orgasm in some people, but some people also need like external stimulation as well, just like people with vaginas.
All right, all right. Next question. We're rapid fire here. So for a very long time, I was one of those people that had a very repressed sexuality while also being extremely sexual. So what does that mean? Like I was raised to be like, hey, your job is to be a sexual being for men, and you have to do that. But then you can't masturbate and you can't figure out what your interests are and all that stuff. So I simultaneously was like hypersexual, like look at me, just look at me. But then also being like, yeah, but I also don't masturbate, and like I'm afraid to touch my vagina because what will happen if I do? I literally, the first time I did that was because a gynecologist was like, you should know. Do you even know what it looks like? And I was like, why do I need to know what it looks like? And he's like, because it's a part of your body that's on you. You should know what it looks like. So anyway, the point of this story is a question like, is that common? Like, is there a big difference between, people who are born as women and experiencing this, or femme presenting, or you can correct me also if there's a better term for that. But yeah, is that like a common thing that we have, that women have to deal with?
For sure. So some more inclusive terms that people like in this field use are like either assigned female at birth or assigned
Okay.
male at birth,
Mhm.
or like I'm really comfortable talking about genitals, so I often just say things like vulva owner or penis owner.
Oh, okay.
I know, yeah. It's usually what I do in my streams. That's how I refer to people because it's
Okay.
short, sweet, and to the point.
Yeah.
However, either whichever one you are comfortable using
Sure.
is fine.
Mhm.
But yeah, absolutely. So the society that we live in, and a lot of other societies that currently exist, prioritize and normalize sexuality and pleasure for people that were born with penises. And the reasons for that are, historical and centuries long. But people that were born, with vulvas have been taught throughout the centuries that we are not supposed to be sexual for anybody but our husbands, and that the only purpose of that sexuality is to provide our husband with an heir. So, that gets pushed down through hundreds and thousands of years. And even though that's not necessarily true today, we know that, sex exists for pleasure and that not everybody wants kids, that those innate societal ideas are still inside of us. And breaking out of those societal holds can be really difficult when they've existed for so long.
Yeah. Yeah. So to answer the question, since it came up in chat, the first time I tried to masturbate, I was 16 and I was so ashamed of it. I didn't really try again until I was 29.
Wow.
I've had sex, but I just didn't masturbate because it was like, why would I do that? And then there was the second thing of like, why would I have sex? Why would I spend time pleasuring myself if I should be having sex? Like it was like, again, if I'm not doing this for which my partner never contributed to this. This was all like raised within me. But like, yeah, if I'm not doing it with him, then I shouldn't be doing it. Like I have to save it for him. Which
absolutely. That's that idea that we have.
Yeah.
I'm glad that you were able to break out of that eventually.
Because of him.
I'm sorry. Well, that's.
I literally said that to him.
That your partner, that your partner has been that supportive, because not everybody is that lucky.
Yes, indeed.
So claps for your partner there.
Thank you. Yeah, no, I literally said it out loud, and he's like, "Are you out of your mind?" He's like, "What? No." Yeah, the whole he owns it crap. But it wasn't like I've been with him for 13 years and it was never anything that came out of his mouth in any shape or form. It was just like this, it was so internalized. So yeah. So how did you specifically get into sex education, being again a vagina owner? Like how did you allow yourself to break out of those barriers?
So I too was raised in a very sexually repressed environment. I was raised Catholic. So it was
bonus.
that really real like sexual repression, and about how you're going to hell if you don't save yourself from marriage and those types of things. And I used to have to go to purity conferences where they would put tape on our arms, like put stick tape to one person's arm and then stick that tape to another person's arm, and basically say that like women who have sex are like that used piece of tape. So I was bombarded with terrible ideas about sexuality from a very, very young age. I mean, elementary school type age. And I was in my late teens, 18 or 19-ish, and which is actually very early for a lot of people that have had these experiences, when I started to have my sexual awakening. And it was mostly just because of questioning beliefs like questioning, okay, well, why, if these things are true
Right.
that I've been told, why are they true?
Right.
I was always very like logical and scientific minded.
Yeah.
So, and there was no logic or science
No.
behind it. So questioning it made me realize like, well, okay, if these things are lies, then, you know, there's no need for me to feel this shame. And I obviously didn't break out of it immediately.
Right.
But
right.
I, you know, started this awakening and started experimenting. And I became so passionate then about talking about sex and like trying to break that stigma, just like amongst my friends and amongst society. And people, like, I would make Facebook statuses about it that people would enjoy, and people would say things like, oh, you should blog about this. So then I started a blog, and then the blog led to people saying, you should do this for the rest of your life. And I was like, well, can I? Is this a thing that people do? And I Googled it, and lo and behold, you know, sexuality educators are a career.
Yeah.
And I was almost completely done with my first bachelor's degree. So decided to finish that bachelor's degree and then go for a second one to completely start over and get into this field.
Yeah, super easy, super plain, barely an inconvenience. Yeah. Do you still have moments where you like, are you totally in and totally on board? Or I guess the way I can compare it to is like, I still have moments sometimes where I recognize that I apply stigmatic mental health related behaviors towards myself, where I'll be like, for example, I'll be like, I should really take my ADHD meds today. And then the other side of my brain is like, yeah, but I don't want to have to take medication for that. I should just be able to push through it. And then I'm immediately like, okay, that's nonsense. Like, I know that that's nonsense. So does that also happen to you with sexuality related stuff?
I would say that at this point, I am mostly like the majority, you know, completely comfortable and have rid myself of shame, but I don't think it's completely possible to ever fully, you know, like get rid of those ideas. And so I do still experience like minor twangs of like, oh, well, you know, because I'm a woman, I need to shave my legs or things like that that are very related. You know, gender and sexuality are related. And it's easier for me to like tell myself like, no, these things aren't real.
Right.
And I can do that, but I still do experience them occasionally. And, you know, that's okay.
Yeah. Yeah. Heck yeah. Can you like, how do you start that journey of like, so obviously, you know, you said that you started just like asking questions. Is that how you recommend, like if somebody is in a few people mentioned that they were in a repressed home, or, you know, they came out as gay and their parents didn't accept them. Like, how do you start, or like maybe you think you're gay and you're not sure, like how do you start that journey? Is there like is there a good place to start that?
It's a lot easier today than it was a long time ago, because there are so many resources on the internet that are available for young people that are either experiencing a sexual awakening or realizing their gender identity or coming out as queer. And like Scarlet Teen is a really helpful website that I recommend to anybody under the age of 25. I have written articles for them, but they cover like the complete broad spectrum of everything sexuality you can think of. And also just finding like support groups online, finding groups of people that are like you, either your gender, sexual orientation, or what have you, and forming a sense of community. Because if you don't have that community within your own family or your friends or home life, it is extremely beneficial to find it elsewhere. And while the internet has a lot of problems, it also does a lot of really great things.
Right. We're stands of the internet here. No matter that, you know, there are definitely problems, of course. But yeah, so thank you for that. We have so many questions that I want to dive into the community questions if you're comfy with that.
Yeah, lay them on me.
And once again, I'm posting Sarah's link. Please, please, please go and follow them. Reason being, if you like this conversation, you can continue having it on her channel. Yeah, Pastor Terry, all the questions. Exactly. You can continue having it on her channel, and she could definitely use some, I want you all to go and love on her, please. I can remember watching a video on YouTube. It was titled something like, if being gay is the norm, being straight is how people see gay nowadays. It was such an eye opener. Oh, like if the turns were tabled, if the tables were turned. Oh God, Lord. Okay. First question is from Ella the Almighty, and exclamation question will walk you through how to ask a question and add it to this list. You can also remove yourself from the list if you feel like we've already covered it, all that good stuff. So Ella the Almighty asks, do you have any general advice to give someone who's struggling with self-harming, self-shaming, their questioning of their sexuality? And what would be a more, would it be more appropriate to see a clinical sexologist or a psychologist?
Yeah. So the first tips that I have for dealing with shame are firstly to allow yourself to feel and acknowledge that shame. I feel like oftentimes when we are feeling shame, and we realize we don't want to, we try to just push the feelings away. We bury them, we repress them, and that's not the way to work through them. So feeling those feelings is my first tip, and then my next tip after that is it's sort of like a classical conditioning of yourself in a way. But when you have any sort of good sexual feelings or sexual experiences, like when there's a second of that shame not being there, reward yourself. Have a slice of chocolate cake, like do something fun, go out. Yeah.
Okay. I don't know if you've heard of emotional cookies. It's a thing we do it. Okay. Yeah. Give yourself an emotional cookie if you're kind to yourself about your sexuality. There you go.
Yes. And over time, like it basically is conditioning, and it's, it's not perfect and it won't happen overnight, but it is something that can help. And if the shame and guilt is too extreme where, little things like that won't help you, sex therapists obviously are a wonderful, wonderful resource. Obviously not everybody can go to one if you lack insurance or funds, but I definitely recommend sex therapists, like specifically certified sex therapists. There are a lot of psychologists and counselors and social workers that will do sexuality work. But the American Association of Sexuality Educators, Counselors, and Therapists is the licensing board for therapists in this country. And you can go on their website and search for people that are licensed in your area if that's something you feel like you need.
Awesome. And somebody asked a great question in chat, and I would love to hear, because everybody has such a different explanation for this. You use she, her, and they, them. In what preference do you use those pronouns, and why do you use both options?
So I personally don't have a preference, and that is not true for everybody who uses more than one. Any sort of interchangeable, use of them is fine for me. I use she because I do identify as a woman. I am a woman, and so she pronouns fit me, but I also believe that my gender is fluid and that I don't fit into the boxes that society prescribes of womanhood. And so again, that fluidity makes me a lot more comfortable with, gender neutral and non-binary terms.
Excellent.
So yeah.
Awesome. Okay. So there you go. So if somebody refers to you as she or they, you're comfy with either one. Okay, great. Gender fluidity hype. Yes, indeed. Okay. Bliffle Splick asks, since the full shape of the clitoris was only really confirmed in the late 90s, do you happen to have a 3D model of it?
I do.
Wait, are you for real?
I can go grab it if you like.
Please, yeah. Okay, we're gonna see a clitoris model, fam. I didn't know that was an option for us, but that's what we're getting today. People who also identify as they can still feel like they're assigned gender. That's good to know. Yeah, lost forever. That I did know. Yeah. Thank you for the hydrate, Alex. Yeah, it's sort of like a face hugger. I have one. Oh man, Dr. Degenerate MD, thank you so much for subscribing for 2 months in a row. Thank you. Hi, John Coffin. Hi. I understand that your username is a joke, and that's cute. I appreciate it.
Don't mind me gathering myself.
Clitoris, hi. I didn't think those words would come out of my mouth anytime soon. I remember there was one. Glad it's here too. All right. Life is great. Thank you so much for the follow. Go ahead. Let's see it. Yeah.
Okay. It might be difficult to see because it's white, but.
Whoa.
Yeah.
Huh.
And so this is
involved.
This is what a flaccid clitoris looks like. So when a person becomes aroused, all of these swell up to potentially double their size, depending on the individual. But this spot right here is where that clitoral urethral complex is in the vagina. But, yeah. This was actually gifted to me by a professor, and it's one of my prized possessions. I love it.
Wait. Show it some more, because I have to inspect this now. I've never seen this in my life. I've also never thought to look for one. It's so interesting to me because it kind of looks like a ball sack with
So there's a lot of homologous anatomy between people that have clitorises and people that have penises. So most of this is just homologous to the glands, the head of the penis. But so this tissue, these are called the bulbs. This tissue is the same exact tissue as what is up here, the out external portion. And then these are called cura, and these are a slightly less erectile tissue. and these sort of keep the clitoris in place. But yeah, this whole thing is what causes any sort of pleasurable sensations during vaginal penetration.
Oh, so that's the whole getup is right there. Okay,
this is literally everything.
This is the whole thing. Okay, so in some cultures, unfortunately, clitorectomies are performed. So do they just get rid of the top part, or they take that whole thing out?
Yeah. So most, a lot of places that perform like genital cutting of people with clitorises aren't really aware of the full internal anatomy.
Sure.
Like mentioned, even like our society didn't even know until recently.
I literally learned today. I'm 30, so go on.
It's usually just the shaft. So not just the glands, not just the tip, like the shaft, because this is what would be under the clitoral hood.
Okay.
And so it's basically it would be a cut from right here. So while this does remain internally, the nerves are completely severed from that clitorectomy. So there would be no more sensation even internally.
Oh my gosh, I had to ask because I had to ask, but yeah, wow. Okay. All right. Well, you could, if you want to put it down, you can now. I mean, you can hold it, but
I'll just hold on to it.
I feel bad. You're just like,
I really don't. Again, I love this thing. It is, I will show the world this. I want everyone to know what they look like. So yes, please, I will keep it,
Oh, you have to Vanna White the whole episode, just like, and it's great. I'm also glad that you literally said the words, I love this clitoris. So like, that's important to me. That's really important to me, that as a sex educator, that you admitted to that. That's great. So Bliffle, amazing. I'm so glad you asked too, because I wasn't gonna make fun of Bliffle, but I was like, well, what are the chances? I mean, like, I should have a 3D model of the brain. What are we doing here without it? I don't understand. Anyway. Okay, so Rennie Tinkerdork asks, I'm a trans woman and have been on HRT for 5.5 months. I've already experienced changes in orgasms. My main question is, what changes are typical for trans women, and to what degree?
So I am not a medical professional, so I cannot speak to this too much without overstepping
we love that. Thank you.
Of course. But yeah, changes obviously are expected on any sort of hormone supplementation. And that's true whether you are cis or trans. And I think that if you are experiencing any sort of like severe decreases in orgasmic pleasure because of the hormone replacement therapy that you're taking, that is something that should be discussed with the doctor, because that's not a necessarily necessary side effect. It could just be things like dosaging, or depending on how you're taking the hormones and whatnot. So yeah, while some changes are necessary, especially while your body is experiencing those changes, in the end goal, there shouldn't be any sort of drastic changes at all in orgasmic pleasure.
Okay. I would like to add one small thing. Again, I'm also not a doctor. I recently discovered this brand called Le Wand, which does masturbating wands. And they are super duper. I'm not endorsed by this brand in any shape or form, but they are super duper endorsing of like trans women and making sure that trans women feel comfy and also learn how to masturbate and stuff. And so their products also, like, they do like blog posts about it, and they do descriptions of like how to use their products to masturbate if you are a trans woman. So again, I'm not endorsed by them in any shape or form, but if you want to check out Le Wand, LEWand.com, and you'll get like a ton of information there. I just was so happy that they were a trans friendly brand. I was very happy to support them after that.
Can I add to that?
Yeah, go for it.
So there's another company called Cal Exotics, and you can buy directly from them, but they also distribute to different sex shops, and they produce one of the only like masturbating aids for trans men on the market.
Oh, cool.
So I highly recommend, if there's any sort of trans mask, or trans men people, to definitely check them out. And there's also another sex shop called Enby, ENBY. Who was it's owned by non-binary people, and they have tons of gender inclusive sex toys as well.
Oh my god, that's amazing.
And,
all right, awesome.
And not sponsored. Yeah, I just love those companies.
Yeah, perfect. Yeah, that's exactly like when I see companies that are inclusive like that in the sex space, like that's amazing, because there's not enough of that. And again, having discovered things myself, I'm like, everybody should know about this. So I mean, not as far as to become a sexual educator, because I got my hands full with all this mental health education stuff, but like I do get the whole like, how does nobody know about it? Like, it feels like this like secret that society is keeping from everybody. That is a really good time. Like, everybody should know about it.
I agree.
Nanosphere asks, how do people who aren't vagina havers get involved with women's health? Like, how is a gynecologist expected to deal with exclusively vagina, vulvas, and uteruses, and also urinary areas, compared to how urologists are implicitly expected to deal with men's urination?
So obviously, people that have shared experiences in terms of medical care, can be very validating and very empowering for people. So people that have vaginas oftentimes want to be treated by another person with a vagina. But it is entirely possible, in my opinion, for somebody that was born with a penis to care enough about vaginal and vulvar health to be a successful gynecologist or sexual health doctor. So I have had gynecologists that were both men and women. And actually, my most positive gynecological experience was with a male doctor. And I think that sometimes, some of that is that they know that they don't have these personal experiences. So good doctors are going to be even more listening and more affirming and more gentle because they know that they haven't experienced those things and need to do everything they can. That is not true for all male gynecologists. Of
course.
There are a lot of male gynecologists that are not affirming or helpful in any way. But yeah, it's mostly just being an ally and learning everything they possibly can to be the best ally to vagina havers.
Yeah. I will also, I confirm the same thing. The best gynecologist that I've ever went to is the one who was able to solve my endometriosis was male. So
snaps to that.
That's awesome. Yeah. Okay, so next question. Oh my God, there's so many. This is so great. Okay, Zuki asked, do you have any knowledge or recommendations for people who deal with sensory stimulation during sex? For example, autistics. I've seen that some people with ADHD deal with sensory overstimulation as well.
Absolutely. The first piece of advice that I would have for that is to do everything you can to diminish any sort of non-sexual sensory things. So things like turning off the lights, making sure that the room is as close to actually room temperature as possible. Only using sheets that aren't going to cause any sort of sensory overload or feel. And so whatever you can do to really make yourself as neutral as possible before and during the sexual experience. And also communicating with your partner is super important. So letting them know, like, I have sensory overload. We need to take things at this certain pace, or I need you to not touch me here until I tell you to do so. And also exploring your own body on your own without a partner can help you learn where those triggers and where those boundaries are for you to be able to have that conversation with your partner.
That's amazing. That's amazing. If anybody has a follow-up to that, please do ask. I want to hop onto Surreal's question because it's too big for our poor bot. So my sister is 10 and puberty starts around that age. So I thought talking about sexuality would be good around that age. My parents wouldn't do a good job and they teach many bad things. I hope they haven't done that already. School's going to teach her in 2 years and I don't want her to learn stuff from the internet or classmates till then. So I want to educate her and I wanted to ask how to go about that since you're a sex educator.
So generally, the best way to have conversations about sex with young people is to have them ask you questions that they are ready for. So you need to create an environment where they feel safe coming to you to ask questions. So just dropping hints about saying things like, oh, when I was your age, they didn't really tell me a lot of good things in health class. And I wish that I had someone that I could talk to, that I could ask questions to. So creating that environment where they feel safe and comfortable coming to you. Because generally, when people have questions, it means that's when they're ready to know the answers for them. And obviously things are difficult if your parents aren't on board with you educating your sibling. But also doing things like, if you have the ability to like buy books that explain different things about body or sexuality, or, like sending articles that, different ways of doing it where you're not necessarily doing the educating, but still providing them with the education they need.
Got it. Nanosphere asks a follow-up question. I have a similar worry for my nieces once removed. What is a good way to introduce them to such topics about sex in a positive way? Okay, so I think that kind of, Nano, I think that kind of that question was answered, unless you have something to add.
The only thing that I could add to is to really make sure that if you do want to bring it up on your own, really like directly bring it up, to make sure that you aren't showing any sort of shame or embarrassment about it. You have to make it as neutral as possible. Because you don't want to, obviously scare away any sort of young person or make them uncomfortable talking to you, but really just making it like any sort of everyday conversation is really the best way to go about it, because it's how the person you're speaking to feels the most comfortable. So it seems weird just to go up to somebody and start, talking about those things, but there are segues, again, talking about school, talking about friends or relationships, or any sort of segue you can find to initiate that conversation in like a neutral, normal way.
Love it. Love it. Love it. Love it. Love it. Hold on. Okay. Lame, hold on to that question. You'll copy paste it. I see that it's not, but I want to make sure, because Stupid Boy asked this question first and we haven't gotten to it yet. So, Stupid Boy asked, so I have an addictive personality. That includes porn, which makes me hate myself a lot. How does one cope with that kind of addiction?
Mm-hmm. So yeah, struggles with pornography are very common, especially for young people that have accessed pornography, prior to being an adult. And this is something that if a person is experiencing difficulties not watching pornography, they have tried and are unable to, that usually means that intervention from a professional would be beneficial. Therapeutic, help and treatments can be really helpful here. So if it's obviously trying to do things on your own is better than necessarily having to utilize a professional, but also, again, kind of doing that conditioning thing. If you want to watch pornography or feel the need to, but don't want to and don't do it, you have that strength, then reward yourself for having that strength. So little things. But again, if it's something that you are unable to stop yourself, if you can access a professional, that would be the best way.
Yes. Okay. Sarah and M, super excited for today. I'm non-binary and gray asexual. Somebody told me that they could deal with me being non-binary, but not gray asexual. So my question is that when I do have sexual desires, if I act on them, I feel horrible afterwards. Like I did something wrong and it's not natural. So my question is, do you have any recommendations on how to not feel that disgusting feeling after?
Gray sexuality is something that is very in the middle of a lot of things, and it's not very understood as well as like a lot of other parts of the LGBTQIA spectrum. But if you are having negative sexual feelings about having sex, then that can come from a lot of different places. It could come from any sort of like external, like internalized shame that you're experiencing from society, or if it is coming from you're feeling like, oh, I'm not being true to myself, I'm doing something that I shouldn't be doing because of my gray sexuality, then taking some time away from participating in sexual acts with other people could be beneficial. Exploring your body and your own sexuality on your own to, again, try and figure out where those triggers are, what those boundaries are, and taking baby steps with it. Don't just jump right into having sex if it's something that you're not feeling good about afterwards.
Oh, I love that. I love that so much. That's like, thank you so much for answering that. I hope that Lame, I hope that helped. Next question. We have so many questions, fam. Thank you so much. Mitwad asks, I have a spinal injury and may have anorgasmia. Never had an orgasm, even with a prostate stimulation and the like, including stimulation by vibration. Is there a type of doctor I should seek to speak with?
Usually urologists.
Okay.
Non-genital, non-anal orgasms are possible in a lot of people that have had spinal injuries and can no longer feel genital sensation. It takes a lot of work to train your body to do things like that, but it is entirely possible. So yeah, a urologist would definitely be helpful, as would, again, like somebody who's certified in sex therapy. They can help you with something like that as well.
Awesome. What is something that, like, actually, do you have a most common question that like every stream you almost get it?
I don't think so, because there's so many things in this realm.
Mm-hmm.
There's a couple different categories, I guess,
Sure.
I get asked about a lot. I do get asked a lot about gender identity, because that's being spoken about so much more now than it ever has been in our society. But yeah, besides that, things are kind of varied because of how much ground there is to cover in this world.
Amazing. But I love this. This is so great. How do you become a sex educator?
There is not one way to do it. And I know that sounds like a cop-out, but it's really not. And it kind of just depends on what works for each individual. So I love school. I love learning. I decided to take that route of getting degrees. So there is only one bachelor's level sexuality studies program in the country and 3 master's level sexuality studies programs, 2 PhD levels. So yeah, I chose to go the school route. And then after I'm finished with school, I will have enough educational hours and just need my training hours to get certified. So I will get certified through that same organization that certifies sex therapists. But a lot of other people, if school, like that institution of academia doesn't fit for you, that doesn't mean you can't do this work. So going to workshops, you know, like there are sexuality educators who run specific workshops to teach people who are trying to get into this field that don't want to go to school. You can rack up enough educational hours outside of school through utilizing sexuality educators to actually get certified. You just have to have everything like documented and signed off from certified people.
Yeah. Yeah. Awesome. Okay. All right. Great question so far. And Nano, to kind of answer the second part of your question, is you, wait, what? I guess we'll just ask you, how do you start getting like called or requests, or do you speak on this at like university levels or anything like that? Like, is it just through blogging and everything that people are starting to get to know you, or like, where are you in that process, I guess?
So due to the fact that I am still in school, I haven't done a lot of like outside of internet speaking engagements yet. I do a lot of writing. I've been published several times in different websites, so I love to do that. And then I have my own personal blog, but I do have a website where I can be contacted at for professional services. And so, you know, I post my website on things like my Instagram and things like my Twitch page. And so, and there's different options on there to reach out for if you need a group workshop or an individual session or a speaking engagement or what have you. But when I am completely finished with school, we'll have the time to actually completely get out into the real world and do this. It's mostly just networking. So talking to other people that are in this field and saying, hey, where have you gotten work from? And then reaching out to those people to get work. And then eventually, you know, word of mouth, names get around and people end up contacting you too.
Well, you definitely have my reference going forward. If people ask me about a sex educator, like you're going to be my go-to for sure. Jeshua Cat asks, I was introduced to sex in a negative way. Sometimes I still feel guilty or ashamed to have sex with my partner. What is a way to overcome that? And I know we kind of touched on this. So, you know, anything to add?
Yeah, again, feeling those feelings and talking to your partner are some of the greatest things. And I really can't stress enough the finding your limits, your triggers, your boundaries. So a lot of people view sex as penetration, and that's not true. You can have sex without having penetration. So if you are experiencing shame or guilt around this one act, you can do other different sexual activities with your partner that might not bring as much shame or guilt. So, you know, start with smaller things. Use hands or mouths, or even just like, you know, different skin touching things. Find sexual sensations that don't feel as bad for you and do those for a while until you can sort of work your way back up to doing all of the sexual activities.
Okay. All right. Great. This is amazing. Okay. So I have more questions, obviously. How do you like, what is a great place to start if you have never, you know, played with like toys like vibrators and plugs and all of that good stuff? So if you've never ever had one of those because you've been ashamed or told not to, where's a good place to start to like kind of get comfy with that and test the waters?
So the first thing I recommend is please stay away from novelty shops. Any places like Spencer's or places that sell like, you know, funny or extravagant sex toys usually do not have people on staff that are fully capable of like helping you find a toy that actually works for you. So going to feminist or queer owned sex shops are generally the best way. And if you're obviously with things like, you know, like COVID, you can't always go into places,
Right.
or if you feel uncomfortable going to places, you know, ordering things online. But a lot of retailers will have like contact things where you can reach out and say, you know, I'm new to this. I know nothing about this. I don't know where to start. So yeah, I think it's just finding retailers that are, you know, usually again, queer feminist retailers are really, really good at helping people find the right things. I also, I will soon be publishing well, not publishing, more so releasing an ethical sex shop retailer guide.
Ooh.
There are a lot of unethical sex retailer shops
Okay.
out there. And so I'm releasing this list of ones that I recommend that I know are ethical and good and can help people. So stay tuned and people will have access to that soon.
So really, really quick, maybe brief insight, like what would make something unethical?
There's a lot of
a lot, I'm sure, but like what's like
lot.
the biggest red flag? Like if you walk in and you see this, maybe turn around, or if you open a website and you see this, maybe get out of there.
The first one would be a lack of information about the materials being used.
Okay.
So there are a lot of materials that are not body safe that a lot of sex retailers will sell because they're cheap. And they can cause a lot of issues. So if a website doesn't specifically say, we only use medical grade silicone and body safe materials, if you can't find that information in a store, immediately turn around and go the other way.
Gotcha.
And also just looking for inclusivity, places that are owned by BIPOC individuals again, or queer feminist people, like those types of places are more likely to be ethical. Obviously not that, like straight white men can't own a sex retailer shop, but it's just that inclusive places are more likely to have ethical practices.
All right. Off topic of sex education, do you have any pets or a picture, even if we could just see photos?
Pets?
Yeah. Do you have any pets?
So my partner is here listening. And so Ren, if you can hear this, if you want to bring any one of the animals up so I can show them, that would be great.
We want to see some fur babies, apparently. Thank you, Lame, for asking the question. I appreciate you. Okay, then another question. A lot of people, or I've heard. Oh yeah, let's get us the pet. Get us the pet.
Yeah, he's on the ground. Let me pick him up. Hold on. Okay. This is Basil.
Basil is adorable.
He has a little bow tie.
Of course he does. Oh my God.
He was a street cat that we took in about 1.5 years ago. So
the bow tie really does. Oh, what a sweetie. He was kind of grumpy when you picked him up and then you started petting him and he's like all really into it. Oh my gosh. The baby is, everybody's here. Everybody's here for the baby. Oh my gosh. It's a cute cat. It is. Oh, cute baby. Basil, I love you. So handsome.
Everybody loves Basil.
How could you not? He wears a bow tie. He's a gentleman. Puppy. Hello.
That's Kale. All of our animals are named after greens. We have
obviously, why not?
Kale, Basil, and then Sage is the other cat that I'm sure will be brought up shortly.
Oh my gosh, that's amazing. Oh my God. Yeah, I'm very excited. That's adorable.
I completely forgot what question you were asking me though.
Yeah, I don't know either. Who cares? No. No, I was actually going to ask next. Another big kind of taboo subject is anal play. Foreplay, just anything involving the anus is usually considered like super duper. Oh, kitty cat. This is Sage. Aw, I'm so sorry I started talking about anuses while you brought your kitty out.
That's okay. All is good for me. Nothing. So anyway, taboo anal play. Yes.
Yeah. So I guess it's my next question is like, just tell us, is it normal? Like, how do we accept that it's totally okay? Or do we? Or is it,
So the taboo on anal play comes from a few different places. The first is that people associated it with like being unhygienic or being dirty,
sure.
which is not true. It is entirely, if you don't want to come in contact, with feces while doing anal play, there are different ways, clean yourself out. So it's not an inherently dirty practice. And even if you do come in contact with feces, our society is so grossed out by bodily fluids in a way that I don't think we should be.
Right.
You could just clean yourself off and move on. If they're your partner, it shouldn't really bother you. But the second place of the stigma does stem from a lot of homophobia. Yeah. So obviously, a lot of gay men participate in anal sex, and because our society for so long had such negative opinions about gay men, that anybody who practiced anal sex was sort of associated with that negative homophobic ideal. But anal play is done by people of all sexual orientations and all genders. And if it's something that brings you pleasure and you and your partner are both comfortable doing it, there is nothing wrong or shameful about it at all.
Love it. Love it. Love it. I love all of it, obviously. The conversation. just so no. Anyway, so okay, so how would one get started with that as well? Like if you're like, hey, I'm kind of, but I'm nervous. Like how do you figure out, like how do you get comfortable with the idea, I guess?
Hmm. Just like everything else I've been saying, work
Got
your
it.
way up and try on your own.
So much
So
lube.
yeah,
Yeah.
anal play, depending on whether or not you're using, hands or toys or, a penis or whatever, it can be difficult at first until your body is used to that sort of sensation. So, going full blown with like penetration right from the start is not recommended. So, practicing on your own with fingers or with anal beads, smaller things, and then getting like a smaller butt plug or a smaller anal toy and kind of working your way up to experiencing larger things can be beneficial before you ask a partner to participate in it as well. Obviously, this is for receptive anal activity,
Sure.
but yeah, asking a partner to participate in anal sexual activity shouldn't be different than any other conversation about having sex. If it's something that you're interested in, want to try, you just bring it up the same way that you would about oral sex or vaginal sex or whatever it is. And if you are feeling nervous about it, a lot of that just comes from the internalized like shame about the practice. But the band-aid approach is sometimes the best, and if your partner cares about you, they're not going to have any sort of negative opinions about you asking. Even if they're not into it, they should still be respectful of your ask.
Awesome. Mr. Mops, if it doesn't have a flare, don't put it up there.
So
I'm
true.
never going to get that out of my head in those exact terms. So thank you so much for that.
There's an educator who I follow who at the end of every year posts a list of like the top 10 things that people lost in their anuses that year. So I look forward to it every year reading that list.
That's amazing. It's got to be pretty creative.
Oh, it is.
Yeah,
it is.
yeah, because people come up with, yeah. So it's not, if people, I don't think people would put things in there that they're not supposed to if it wasn't so taboo, and you're kind of like, because you're so afraid to get something that's supposed to go in there, you're forced to use something that like you don't know if it's gonna come out. Yeah. Cucumbers, tomatoes, iPod. Oh boy. Oh boy.
Yeah, please do not put vegetables inside of your body.
Yeah.
Inside your mouth. Please do not put them in your vagina. Please do not put them in your anus. Please do not.
Can someone link the list? Maybe after this, if Sarah sends me the link, I'll post it in our Discord.
Absolutely.
Yeah. What is the plural of anus? Is it anuses, anali? Actually, I don't think I ever stopped to think about that.
Yeah, I say anuses, but whether or not that's actually correct, I have no idea. Like, is it a Latin? I don't even know what the root of the word is, but yeah, I say anuses, but don't quote me if that's not the actual correct plural.
Oh man, I don't know. I only have, yeah, that's why I've never thought about the plural. I just, the one is the one I'm concerned about all the time. Yeah. So another one that's come up, I don't deal with this, but it's like the start of every sentence of I don't deal with this, but if a friend were to ask, but seriously, a friend has asked, and the conversation was, if you can't get your partner to do XYZ, right? Your partner won't go down on you. Your partner won't do anal play with you. Your partner, whatever your partner won't do, how do you, like, you don't want to force them, obviously, or not obviously, you don't want to force anybody to do something non-consensual, but how do you maybe get them more comfortable? Because a lot of the times people don't want to do this stuff because of this internalized stigma that has been, brought into us years and years and years and years. So how do we maybe get somebody into a comfy, cozy place where they can start exploring things with us that we would like for them to maybe try out and check out without forcing them?
For sure. So I, really recommend kitchen table talk with partners for sex talk, where you're not in the bedroom, you are not in the heat of the moment. There is no hormones involved. So having conversations about sex and sexuality in a completely non-stimulating environment. And yeah, if there's a certain practice that you have, asked your partner to participate in that they didn't want to, really finding out why they don't want to is, I think, the root here. So, asking your partner, hey, I know that you said you don't want to go down on me. Can you tell me why? And sometimes people don't even know themselves.
Sure.
And a lot of that comes from, like repressed societal ideas. So if they don't know, then, try to work on it together as partners. Okay, well, let's figure out where this came from. But if they do know, if it's like, hey, well, these are my reasons and these are my boundaries, then if those boundaries are something that don't come from external, stigma, obviously they need to be respected. But if they come from something that could be because of, shame or judgment about sexuality, again, working through that with your partner, maybe reading articles together about things, asking, well, okay, well, are there any other adjacent practices that you are comfortable with? Just trying to find some sort of middle ground with things. So.
Yeah, great. Okay, so we've figured out, thank you so much, moderators. We figured out that the plural is anuses or ani, both
Ani
accepted.
is?
Yeah. Yeah, Webster, according to Webster Dictionary. So that's excellent.
I kind of want to start saying that now.
Ani. Ani. Yeah. It does sound like a greeting, doesn't it? Like when you maybe that's what you do. You like go down on your partner and you're like, Ani. Talk to their ass. I like anus. I mean, plenty of people don't, but who doesn't? Since ani is strange. Yeah, it does. It does. All right. So our queue is empty. I think because we like marathoned questions. So if anybody has any questions, now is your time, or forever hold your pieces. Because yeah. Okay. Join along the lines of sensory issues and going down on someone. If taste or smell is a problem with anyone, is there anything that can be done to help that?
Barrier methods. So things like dental dams. They make flavored dental dams that can be used. And then there is also, actually,
yeah, let's go. Post some links.
Let me get the spelling really quick.
That could be a safe word. Ani.
So there is a, and this is for, and obviously, condoms as well, depending on but dental dams can be used for vulvas. They can be used for anuses. But there is also, for people that have vulvas, there is this product called Lorals, Lorals, and again, not sponsored. And they're basically underwear, but they are like 10 times thinner than the thinnest underwear on the market. And they're extremely stretchy. So they're in a lot of ways better than dental dams, and you don't have to hold it. The person just wears it. And you can still, the receiver will still experience a lot of pleasure, even with these on. So yeah, something like taste or, smell is an issue, finding a barrier method that you can use, or again, just like washing yourself before sexual activity, taking a shower, which you can do together, like taking showers together. Sex in the shower isn't always feasible, but like building up some sort of intimacy, and then knowing that the bodies are clean can help a lot of people that might have like scent or taste issues.
Yep. We recently had to reinstall a bathtub. That you just try. I think that's the key to like all of this. You just try different stuff, especially if you want to. Yeah, and pee after sex, is that real? Is that that women or vagina owners should pee after sex?
Peeing after sex helps prevent UTIs. There are a lot of people that like think it can prevent pregnancy. That is not true. There is no statistical.
How would that even? It doesn't wash.
Because the pushing mechanism they think will push out like semen or sperm. Yeah,
not enough.
Right. Exactly.
They're stubborn.
But yes, but it can help prevent UTIs because obviously there's a lot of things happening down there during sexual activity, and like bacteria that live in the vagina are only meant to be in the vagina and nowhere else. And if they happen to work their way up the vulva into the urethra, that's what can cause UTIs. So flushing out that bacteria immediately afterwards is definitely recommended.
Yeah. Excellent. I'm glad we got over that. Wait, do penis havers, does that benefit them too? Like, should they also pee just in case or not?
People with penises are not as prone to UTIs as people with vulvas are, but it's a beneficial practice for anybody for sure. Obviously, not having as high of a risk of developing UTIs means that I feel like a lot of penis owners feel the need to take that practice. But yeah, if it is something that a person decides to do, it would help and prevent UTIs were they ever to occur for that person.
Excellent. So we are coming to the end here, and I'm very, very sad. But I mostly, so I want to ask you if there was one thing that you want people to take away from this conversation, that you want to make sure that people know and understand about sexual education. First of all, obviously, it's to follow the heck out of you, and I want you to plug yourself and all that. But what would that be? Like, what do you want people to walk away with and know? In their hearts?
The biggest takeaway for me is that we all experience usually some sort of sexual internal issue in our lives, be it shame or guilt or struggle with an identity or what have you, that there is a light at the end of the tunnel and things will get better, you know. And I know that that's really difficult for a lot of people to see if you are living in an environment that is not supportive of you. You know, I've been there and I know how difficult that is and I know how painful it can be, but there are a lot of resources and a lot of things out there that can help people get through things. So whether or not, you know, you are a sexual being or not, you know, understanding your body and your sexuality is super important. And it does get easier as time goes on.
Okay. Okay. I'm gonna take this last question because Jessie Jaws asked it. I'm very interested. I have a question. When I was younger, I made up a story of a female friend I had, and now she's actually been part of me for many years. And I want to know from Sarah if this could actually mean that I was meant to be female, and it's kind of her way of getting out.
Gender identity is extremely complex, and especially in the sense that, you know, it is fluid and dynamic and can change over time. And there is nobody, and I mean this, there is nobody that knows your gender but you. And if you feel like there's something womanly inside of you, if you feel like there is a feminine part of you, you don't, you know, that can be true for you without you having to label it. If you want to label it, if that's something that's important for you, you know, exploring that part of yourself and that idea can be really helpful. But if it's not something that you feel the need to label, you can, you know, just live your life as you are, exploring that part or not.
Excellent, excellent. I talk to my inner child. It's my favorite. That's my talk to them perspective. I recognize that everyone has that. I think it's a good practice for people to get into, even if you don't right now. Okay, so how can people find you? What times do you stream? How often do you post blogs? All that good stuff. So please, 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 I'm posting Sarah's links. Go ahead, Sarah.
Yeah, absolutely. So my Instagram is Sarah Talks Sex, one word. I post just weekly bits of information there all over the sexuality spectrum board. Instagram has been trying to repress sexuality educators lately, but as of right now, I am still there. You know, they haven't gotten rid of me yet. But I post a lot of different broad information there. I also have my website, sarahtalksex.com, where you can find me for professional services. And I do book reviews there and post blogs. And then, yeah, my stream name is Sarah_talks. And currently I'm doing streams on Tuesdays at 4:30 p.m. Eastern Standard Time and Fridays at 6 p.m. Eastern Standard Time. That will likely change at some point in the future based on my school schedule, but at least for the next several months, that's when I'll be streaming.
Awesome. Okay, everybody is saying thank you, thank you, thank you so much. Everybody, please stick around. I will be right back-aroo. This was an absolutely wonderful conversation. Thank you so, so much, Sarah, for hanging out with us tonight.
Thank you so much for having me, and thank you